Understanding genetic breast cancer risk. What to know. Imagine uncovering a hidden piece of your family puzzle that could influence your health for years to come. That's what understanding genetic breast cancer risk is all about. It involves looking at inherited changes or mutations in specific genes passed down from parents. The most well-known genes linked to hereditary breast cancer are called BRCA1 and BRCA2. Women who carry mutations in these genes face a much higher chance of developing breast cancer during their lifetime, up to about 70% for BRCA1 and 69% for BRCA2. Men with BRCA2 mutations also have an increased risk, around 6.8%. But it's important to remember that only about 5 to 10% of all breast cancers are caused by inherited gene mutations. Most breast cancers develop from genetic changes that happen during a person's life, not from inherited mutations. Family history plays a big role in understanding risk. If you have close relatives like your mother, sister, or daughter who have had breast or ovarian cancer, especially at a young age, it might suggest a genetic predisposition. These patterns often follow an autosomal dominant inheritance, meaning just one copy of an altered gene from either parent can increase your risk and be passed on to your children. Besides BRCA1 and BRCA2, other genes can also contribute to hereditary breast cancer risk. These include genes involved in syndromes like Lynch syndrome, which can increase the risk of several cancers. Each gene varies in how strongly it raises risk and how common its mutations are. But genetics are only part of the story. Other factors influence your overall risk too. Reproductive history, such as the age when you started menstruating or went through menopause, hormone use, lifestyle choices like alcohol consumption, smoking, and physical activity all play a role. Breast density and previous radiation exposure also matter. Modern risk models combine genetic information with lifestyle and reproductive factors to give a more complete picture of your individual risk. If you're concerned about your genetic risk, genetic testing can help. It looks for mutations in BRCA1, BRCA2, and other related genes. Knowing your status can guide personalized prevention strategies, such as more frequent screening with mammograms or MRI scans, lifestyle modifications, or even preventive medications or surgeries. But testing is complex, and it's essential to work with a genetic counselor. They can help you understand what the results mean and support you in making informed decisions. It's also important to recognize that most research and risk models have focused on populations of European ancestry. Efforts are ongoing to improve risk assessment tools for diverse groups, ensuring everyone gets accurate information and appropriate care. For those with a known genetic risk, early detection becomes a priority. This might mean starting screening at a younger age or having more frequent exams. Preventive options could include lifestyle changes, medications to reduce risk, or surgeries to remove at-risk tissue. All these choices should be discussed carefully with healthcare professionals who can help tailor a plan that fits your personal situation. In summary, understanding your genetic breast cancer risk involves knowing about inherited gene mutations, especially BRCA1 and BRCA2, and how family history and other factors influence your overall risk. Genetic testing and counseling are valuable tools to identify high-risk individuals and guide prevention efforts. Remember, each person's risk is unique, and the best approach is always to consult with healthcare providers for personalized advice. Staying informed and proactive can make a meaningful difference in managing your breast health.